Mental health and wellness. Recognizing and confronting mental health problems. Mental illness can be defined as experiencing problems that are affecting functioning and are more than normal reactions to negative events in your life. Mental illness usually involves normal feelings like sadness or anger, but on a more severe or more consistent level. They often also come on suddenly without an apparent cause and do not go away on their own. Most people will not experience mental illness in their lifetime, but a significant number of people will face mental health issues at some point. Globally, more than 1 billion people currently have a mental illness, and these illnesses are particularly common among young people. So it's important that you recognize when you or someone you know may have a mental illness and therefore need help. While mental illnesses include schizophrenia and other psychotic disorders where a person loses touch with reality, these are uncommon. In this section, we will discuss the more common mental health conditions of depression, anxiety, post-traumatic stress disorder or PTSD, and substance misuse. You can think of each of these as extensions of mental states that we typically experience as a result of adverse events. Depression. Let's start with depression. If you have experienced a loss in your life that has really affected you, such as the death of someone close to you or an intense romantic breakup, then you have experienced something like depression. Normal reactions to severe loss and depression have a lot in common. You feel sad, empty, or hopeless much of the time. You may lose interest or pleasure in activities you previously enjoyed. Your appetite and weight may go up and down. There are problems with sleep and fatigue, difficulty concentrating, feeling worthless or guilty, physical aches, pains, or digestive problems without a clear physical cause, feeling agitated or moving or speaking slower than usual. These are also symptoms of depression. Anxiety. Anxiety, or worrying about something, is common, but could also be so severe or frequent that it impacts daily life, relationships, and functioning. Depending on how severe the anxiety was, you may have been unable to stop worrying or fearing the worst, felt irritable or restless, and had difficulty concentrating and sleeping. When the worry is intense or prolonged, we tend to also get physical symptoms, such as a racing or pounding heart, feeling short of breath, sweating, tense muscles and fatigue, and nausea, diarrhea, or other digestive problems. Post-traumatic stress disorder, or PTSD. When we experience or even see a traumatic event, this can also produce a typical reaction by the brain. Traumatic events are those where you or someone else is badly injured or hurt, or feel that you or they might be injured or hurt. Examples may include a very bad vehicle accident, or sexual or physical abuse. This is less common than losses or anxiety, and so most of you will, hopefully, not have a traumatic experience, but some of you have, or will. After a traumatic event, people often experience intrusive thoughts, repeated, unwanted memories of the traumatic event or flashbacks that make the person feel as if they are reliving the event. People may also have disturbing dreams or nightmares and intense emotional or physical reactions, like panic or sweating, reminders of the event that may lead to feelings of fear, guilt, shame, or anger, or feeling on edge and irritable. Because these are so unpleasant, the person will try to avoid places, people, or situations that remind them of the trauma and not want to talk or think about it. This may cause them to withdraw from others and from normal activities. Substance misuse. Finally, there is substance misuse. Many people drink alcohol or use other drugs occasionally in ways that, while not advisable, do not cause significant harm. Substance misuse refers to using drugs or alcohol in ways that harm a person's health, relationships, or responsibilities. Physical health suffers in ways that can be observed by the person or others. Sudden weight loss or gain, bloodshot eyes, poor hygiene, shaking of the hands, or difficulty speaking clearly. The person may have more frequent sickness, headaches, nausea, or unexplained injuries. People misusing drugs find that they need increasing amounts to get the same effects, and when they don't use drugs, they have withdrawal symptoms, sweating, shaking, nausea, or anxiety. Relationships suffer as they neglect their responsibilities, missing work, school, or family duties. People may also undertake risky behaviors like driving under the influence or unsafe sex. They may withdraw from relationships as they experience depression or anxiety and lose motivation or interest in people and activities. Let's move on to the next module.